On the health care side, obviously, the county is often the only hope to those who find themselves without medical insurance. In fact, across county facilities, we have almost 3 million outpatient visits a year, over 260,000 emergency room visits, and close to 500,000 hospital inpatient days each and every year. This is a massive undertaking and at a very enormous expense. As an update on a couple of the hospitals that I've mentioned in the past, the Harbor UCLA Medical Center in Torrance, which has provided health care services to the greater South Bay community since 1946, is undergoing a thorough major facelift. The board approved a $330 million plan to minimize the overcrowding in the ER by tripling the size of Harbor's emergency department and by renovating their very out-of-date surgical ward. Construction has begun and is expected to be completed in July of 2013. The county is on track to open the new Martin Luther King Medical Center. You've heard me report on that before. In 2013, we'll have 120 beds in the emergency department with a capacity to accommodate more than 30,000 annual inpatient visits and more than 10,000 annual outpatient visits. This new facility will be privately owned and operated by a new nonprofit entity with an independent board of directors that will oversee the hospital's operation. By mutual agreement, the county will continue to provide the ongoing funding, and the University of California will provide the physicians and establish standards regarding their quality assurance. While I'm very pleased that these projects are moving forward, the reality is that we must evolve in the way we provide health care. We need to move away from a model that the emergency room becomes a medical home for these folks that relies on these gigantic hospitals. We have some very successful community clinics across Los Angeles County which provide excellent care and support for our big hospitals. Some providers even take it to the streets. We have a great example here in the 4th District with the South Bay Family Health Care's Healthy Kids Express. This mobile clinic goes to local schools, community events to provide preventative services, immunizations, but also care for kids who are ill but cannot seek medical care. They help many children who meet the requirements to get into Head Start programs. They've been known to help those who say, "What was he thinking?" moments, like recently when a young boy stuck a pencil eraser in his ear. I'd like to thank South Bay CEO Jan Hamilton Lee, who's with us today, for all that her organization is doing to help kids who don't have access to health care get the services they need to grow up healthy. I'd like to have Jan please stand. And right here in your own backyard in Long Beach, we have 2 incredible healthcare system clinics, and that's the Children's Health Clinic and the Children's Dental Clinic, who continue to provide those much-needed services to all that may otherwise not be able to receive them. These types of clinics should be expanded, which would relieve some of our overcrowding we have at our large hospital facilities, as well as the public and private emergency rooms. Community clinics can support the work of big hospitals by providing more and non-life-threatening service in a much less expensive way. The cost of providing health care to all of us is at the top of our mind, as it is to all of you here in this room. No matter what happens with the new Congress and Obamacare, let me be clear, expanded care is a good thing. But the problem is it's not yet clear what increased coverage means and who's going to foot the bill. We must control cost, be smart about how we provide those services.